Hey folks, Dr. Bob McCauley, and just got my latest blood work back. I always am talking about my blood work and other medical tests that I take, so always got to be honest about everything. This is not going to be an easy one for me, I can assure you. Hold on. So yeah, just got my blood work back. It's the only reason I go to a doctor anymore. Why else would I go? I haven't been into an accident or anything like that where I need, medical attention or physical therapy or anything like that. Physical therapists are great, and emergency doctors are great, and surgeons are great when you get in accidents. But other than that, what do we have doctors for? I don't exactly know. Anyway, I just got it back, and as I said, this is not going to be an easy one for me. No, because I have to contain my ego or my joy or whatever, because as the cat once said, it was perfect, and I got all the tests. I mean, I got everything you could imagine. I got all the vitamins. I got everything, and it was perfect. Let's go over it. So yes, I went to the doctor. I'd never been to this doctor before. Very nice guy. Really liked him a lot. I go to Sparrow Hospital up in St. John's. I got to pay for it because I really don't have medical insurance or health insurance. I just have accident insurance because why would I have medical insurance? I mean, I'm not going to use medicine. I'm not going to get sick. Okay? I mean, if I get sick, this is going to be like with something serious like cancer, It's a career ender for me. I can't get cancer. Okay. Anyway, just kidding. So I go in there, and he says, when you been to the doctor last? And I said, well, I don't know, 10, 15 years ago. I've had blood work since then, but I haven't been in for a physical. So he gives me the shame on you. You need to come in every year. And we got to check everything. Well, he checked everything. And again, one of the interesting things he says, okay, so you on any medications? No. He says, I've never had a patient in here at your age, and to just be clear, I'm 59 and a half, I'm pushing 60, and I've never had a patient in here before at your age who wasn't on medication. And then he did the whole workup and everything, and he can see not only I'm not on medication, I don't need that medication. And he's really kind of searching for any kind of way to put me on medication. My blood pressure was slightly high. Maybe we can look at this in a couple of years and put you on some medication. My blood pressure is always a little high. It always has been. It's since I was 16. I run a little high. everybody's a little bit different, so it was just kind of funny. And this doctor, by the way, very nice guy, because if he wasn't, I'd tell you, he was on blood pressure medication. But anyway, I used to have a woman doctor, and no offense, but she just, she's retiring, and she's my age, and she just, kept getting older and older and older, and I really wasn't getting older. And last time I saw her, which was I don't know how many years ago, she said, "Don't come in here again." So I said, "Okay, I won't come in." So I didn't, but I've had a couple of blood work since then, life insurance, some other stuff. But this one, again, came back perfect. Let's go over it really quickly. Okay, first one, just go very quickly. This, I gotta love it. CBC with differential. This is like your immune system. Perfect. Okay, it's your white blood cell, it's your white blood count, it's your total hemoglobin, it's all your red blood cells, it's everything. Perfect. Okay. Comprehensive metabolic panel. That's all your, it's calcium, it's bilirubin, it's the sodium, potassium. It sort of looks at everything. Perfect. Okay. Lipid panel. Lipids, your fat. That's going to be your cholesterol. Is it too high? Your triglycerides. HDL, LDL, the good cholesterol, the bad cholesterol. Perfect. You can go crazy talking about all this stuff, and people want to know about their HDL and LDL. I never think about it because I just put the right things in my body all the time. And that's all you got to do. You want to run everything since it's been so long since you've been in here? I said, yeah, I want everything. It's the only reason I went there, to get the blood work. I know I'm going to come back perfect. Ferritin, okay, that's your iron. I should have low iron. I'm a vegan. I don't eat any meat, fish, eggs, or dairy. I mean, can you see my skin here? It looks pretty good, right? It's the middle of the winter in Michigan, so I don't have a tan, but okay. Iron's perfect, you know. Now, where would I be getting my iron? I'm going to save this. I'm going to save this for the last. Okay, here's your vitamin D. Everybody takes vitamin D supplements. It's probably the most common supplement now is vitamin D. Gotta have vitamin. You know, where do I get vitamin D? I don't know. Maybe from my diet. I get into the sunlight a little bit. I'm in Michigan in the middle of winter here. Seriously, there's no sunlight. Believe me, I'm in Lansing, Michigan. No sunlight. Like a cloudiest city in the country. Okay, vitamin D, D2, D3, perfect. Okay, eGFR. Okay, you get it. It was fine. My PSA, very low. That's your prostate. You know, you girls out there don't have to worry about prostate. Occult blood stool, man. It was a negative, and I came back perfect. I don't even want to talk about this one. You know, I mean, this is your prostate, and I mean, they're looking for polyps, and so anyway. Wow. TSH, okay, that's your thyroid. Of course, it's in the range. It's perfect. Where do I get iodine to feed that? Brown seaweed extract, concentrated kelp. Iodine is a huge molecule. It's found in very, very few foods in the world, anywhere. It's extremely important. It regulates our thyroid. Every drop of blood goes through the thyroid every 15 minutes. Things like fluoride, which is in drinking water everywhere in the country, interferes with it, interferes with the uptake. It's in the same line on the periodic table. And mine's great because I have brown seaweed extract every single day, concentrated. Folate, that's B9, came back perfect. And B6, again, guess what? What a shock, it came back perfect. All the B vitamins, none of which I should have because I'm on a vegetarian or a vegan diet. They're all there and they're all in the right range. So just, you know, here's the evidence. And again, how do I feel? And I just had this full physical from the doctor. How do I feel? I feel great. Here is my favorite one, folks. This is the one, like, if you're vegan, I've talked by a really, really famous naturopath told me years ago, B12. B12. You can't get B12 from anywhere other than animals. I don't know where animals get it from, but I mean, you gotta have animal. I watched this movie recently, Into the Forest, and they had to have B12 because the woman was pregnant. So they went and killed a pig, and they shot it and ate, and then she had B12. Guess what? So if you don't supplement somehow with B12, you just can't get it. Well, you know what? Huh? How about that? B12. You know where you can get it from? Spirulina and chlorella. Now that'll really make a lot of people mad because, you know, there's like analog B12 and then digital B12, not digital, but I'm just kidding. But there's just different types, and they just don't work if you don't have the right B12, like you can't get it from like algae. No, you can't do it. Okay? I guess you can get it from algae. You can get it from all sorts of foods. I mean, my B12's nice and high. I have plenty of energy. B12 is synonymous with energy, high energy, good, having a lot of energy. I work out every day. You won't believe how hard I work out. And I'm going to tell you, folks, there it is. This is the one I really love because I've listened to so many years. So this famous naturopath, I won't mention his name, he told me, he says, you're going to go, I don't know why, you're going to go 8 years and then as a vegan, and then you're going to run out of B12. I don't know why, but that's what happens. Well, was he an algae taker? Did he take around, 12 to 15 grams of algae every single day the way I do? Spirulina and chlorella, two most powerful foods in the world. That's where I get my B12. That's it right there. So you don't need to go to the animal world. You don't need to eat insects, as some people have suggested. You got to eat ants and you get B12. There's B12 there. I'm not suggesting there isn't. You're going to eat an insect to be healthy? Okay, I'm not drinking my urine and I'm not eating insects to stay healthy. Sorry, not happening. That's it. And because you don't need to. And plus, that's just, that's a bridge too far for Dr. Bob. But this is the one that I really, really, really love. B12. You're just not supposed to be able to get on a vegan diet, stay on it long term, and have enough vitamins in your diet. Your vitamin D shouldn't be there. I mean, that was another one. I love that one. I mean, all my vitamins were great. Everything I did was really right in the range, right where it was supposed to be. Some of them you just below this is bad. I was way off the scale. I had plenty of it. Now, people always get me for this, and they say, "Hey, quit bragging. Quit bragging." I'm not I'm just telling you, how can I do this? Okay? Am I someone special? I'm not special. The only thing that makes me different, and it's not special, is that I'm doing it. Okay? Anybody can do this. I got to tell you, really, I think other people could do a lot better job. Just be better than I'm doing. But I'm doing it. I'm on a raw food diet. I take spirulina and chlorella. That's what I use for my protein. That's why I'm a successful vegan. I go on about this all the time. I went on the vegan diet, and I did it to a T, and I got sick. And I got sick after 2 years or 5 years. I don't know why they waited this long, and I got sicker and sicker. Well, I haven't gotten sicker and sicker and sicker. Always plenty of energy, very clear thinking, never foggy, and never the morning brain fog or any of this kind of stuff. Anybody can do this. Okay? Look at my 7-component health protocol. So I'm not bragging. I'm not telling you how great I am. I'm telling you, you can do this, and the only reason you're not getting these results is because you're not doing it. You're not following my 7-component health protocol. Water. In particular, ionized water. Spirulina and chlorella, 2 most powerful foods in the world. Raw fruits and vegetables. Exclusively, as much as you possibly can. Probiotics, prebiotics, the friendly bacteria, fermented foods, digestive health is critical. Okay? Minerals, staying mineralized. I like angstrom minerals, liquid angstrom minerals. You really got to supplement with some kind of minerals. Very difficult to get all the minerals you need without that. Vigorous exercise every day. I got that one covered, believe me. I'm in great shape and a positive mental attitude. You do all those things, and all these great results will follow, and you will never have a serious health challenge. Dr. Bob McCauley. I'll see you guys next time.